So this is the second audience response question. A 2-month-old boy presents to your clinic with a flat red patch on the upper face and periorbital region. This was noted at birth. What is the most appropriate clinical management at this time? A, reassure the parents that this birthmark will likely fade away by the time the child is 5 years of age. B, obtain a baseline ophthalmologic evaluation to screen for glaucoma. C, obtain an echocardiogram to rule out coarctation of the aorta or other cardiac defect. Or D, obtain a head CT as soon as possible. Let's see. Okay, so I think what I'm seeing here, the majority is saying to reassure that this birthmark will likely fade away with time. I'm going to go back just to point out. Can I go back here? It's maybe hard to tell in this image, but the stain actually spares this midline and kind of is over the bilateral foreheads, and it does extend into the cheek. So this is a port wine stain that is in this distribution that includes the upper eyelid and the forehead, and it's kind of. This one was not, it was on both sides of the face. So this one was a higher risk for Sturge-Weber syndrome. And so that's why the important thing to do here is the baseline ophthalmologic evaluation. And so that was an example of an infant born with a capillary malformation or a port wine stain. And here in these two images, you see some other examples of that. And on the right, you see when this is left untreated, what can happen. It turns the color of port wine, and you can have hypertrophy of the mucosa, as you see there. And so this is a congenital vascular malformation where you have increased number of capillaries in the dermis, as well as they're more tortuous and they're abnormal looking. And this is something that we see in about 0.3% of normal newborns. We now know the underlying genetic pathogenic variant here, which is a pathogenic variant in GNAC, which is responsible for vascular proliferation. This initially can be pretty subtle and can mimic a nevus simplex, which I think that's what a lot of people were thinking when they chose just reassurance. That is the differential diagnosis, but these don't lighten in the first couple of years. In fact, they darken, and sometimes, into puberty, they can thicken and become nodular. They don't regress, especially when they're on the head and neck. They are associated with a lot of psychological morbidity. It's most commonly facial, but can be found anywhere on the skin.